Hello and good afternoon to everyone who is joining us today. We would like to welcome you to the Health and You Community Wellness Series. We're really excited that you could join us today. I'm Dr. Sohela Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine, and we're really excited to see you here today with us. The Health and You Community Wellness Series has been created to create community awareness about health and disease. And the ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. Just some housekeeping rules. Your cameras and microphones are turned off. Please use the question and answer feature to type questions or put in your comments. We will address the questions at the end of the session. And just a reminder, this is not a CME or a CPD activity. No certificates of attendance will be issued. So today's session is just about moving. So just keep moving. It's easy and healthy. And the online session will define physical activity. It'll clarify some common myths and misconceptions around physical activity. The session will also underscore the health benefits of being physically active and how this can be integrated into a daily lifestyle routine. And the speaker for today is Dr. Sathyanarayanan Doraiswamy. So it gives me great pleasure to introduce my colleague, Dr. Sathyanarayanan Doraiswamy. He is the Assistant Director at the Institute for Population Health and also an instructor in Population Health Sciences at Weill Cornell Medicine-Qatar. Dr. Doraiswamy has more than 20 years of experience as a public health professional in working in Asia, in sub-Saharan Africa, and Europe within governmental and non-governmental organizations, including the United Nations. He has considerable experience of teaching and public health research, as well as expertise in supporting humanitarian public health responses for populations affected by conflict. Dr. Doraiswamy's work has been published widely in peer-reviewed journals and presented at several global health conferences. He is a medical doctor by training, also has a community medicine degree and a professional doctorate from the University of Bath, United Kingdom. He's board certified in public health and also a certified lifestyle medicine physician. He has also received additional diplomas in applied population research, applied statistics, and human resource management. So Dr. Doraiswamy, again, a very warm welcome to you. And we are very, very excited to have you as a speaker today. Welcome, and over to you.
Let me take this opportunity to wish everyone Salam Alaikum, Ramadan Kareem, and a very good afternoon. So thank you so much for joining us for this 45 minutes of talk on physical activity and why physical activity is so important to be mainstreamed into our daily lifestyle. So as I mentioned, so this discussion will last about 45 minutes. I hope to have this talk for 30 minutes, opening up for questions and comments and sharing of experiences for about 15 minutes. In this discussion, I want to declare that there's no relevant financial relationships for me to disclose, and I will not also be discussing any unlabeled or unapproved use of drugs or products. This discussion is going to have a threefold objective. Firstly, I will try to outline some of the components of physical activity, and we'll also discuss why it is important to be physically active in our life, and also explain some principles of motivation and what are some of the practical measures and tips that one can take in ensuring that we remain physically active. Firstly, there are certain terminologies that we need to clarify and make sure that we use them consistently, not just in this particular discussion, but also in ensuring that we mainstream physical activity in our lifestyle. But firstly, when we are talking about physical activity, we are talking about a situation where there is a movement of the body involving contraction of the muscles over a sustained period of time. And the physical activity is when the physical activity is more organized, is more planned, and is also recurring, then we call the physical activity as exercise. And in exercise, there is usually a pursuit to reach a state of fitness. And by fitness, what we define as fitness is really about making sure that one is able to carry out their normal day-to-day activities, is able to enjoy leisure, are also able to respond to emergency situations with adequate energy and vitality, and making sure there's no fatigue associated with it. So exercise leads to fitness. And often the terminology that is confused is physical inactivity and sedentary behavior. So physical inactivity, by definition, is a situation where an individual does not meet the global guidelines and the standards required for physical activity. So that's when a person is said to be physically inactive. And what these standards are and guidelines are, we will visit them in a minute. But sedentary behavior, on the other hand, is a step above physical inactivity, is a situation where a person spends most of their time either sitting or lying down. And so there can be a situation where a person is physically active, but also be sedentary. And by definition, a person is said to be sedentary or having a sedentary lifestyle when 50% of their non-sleep time is spent either sitting or in a lying down posture. These definitions are quite important because we have to understand some of the guidelines and the standards that have been set for these behaviors. Again, when we talk about physical activity, even though physical activity, as I mentioned, is any movement, and the most important aspect to understand is that any physical activity or any amount of physical activity in life is going to be helpful from a health and well-being point of view. Of course, meeting the standards is optimal, and that's what one should be striving for. But any amount of physical activity is helpful. So you do not necessarily need to exercise and to go to a gym or have specialized physical activity for you to remain fit in your life. So any amount of physical activity and any type of physical activity is helpful. That's the most important, starting point for our discussion. And when we talk about physical activity, often the most striking feature of physical activity is often the aerobic part of physical activity, or referred to as cardiorespiratory endurance, which again is a situation of a group of muscles being put to action over a sustained period of time, with the ultimate objective of making sure that your heart is able to respond to any form of emergency situation. So you're kind of fashioning or you're conditioning your heart to be able to respond to stressful situations. So that's often the cardiorespiratory endurance or the aerobic exercise. And you have some of the examples that are there in terms of running or jogging, walking on a treadmill, using a jump rope, and so on. So these are the common examples of aerobic cardiorespiratory endurance related activities. The strength and resistance activities are another type of physical activity where the body and the muscle has been subjected to some form of external resistance, and the muscle has to contract against this resistance with the ultimate objective of building the lean body mass and the muscle mass. So this is the strength and resistance related activities. The third aspect is around flexibility of the body. And the flexibility, the terminology refers to in terms of the various kind of movements or actions that happen around the various parts, various joints of the body. And in flexibility, of course, the movement happens around the joints, but there is a significant contribution happening not just from the bones, but also from the muscles, ligaments, and tendons. When these entities work together in unison, the body becomes flexible at various joints. And last but not least, the importance of balance activities as well. And balance is often the ability of the body to withstand any form of destabilizing stimuli. And this stimuli could be the movement of the body itself, or it could be an external object, or it could be some environmental conditions. So any of this can kind of destabilize the human body, and the body needs to withstand this and stand and stay upright during these situations. And a set of activities as simple as lifting a leg up and standing on one leg is also a simple example of what a balance exercise means, or a balance activity means. So both flexibility and balance are quite important, as we will see, in order to ensure that there are no falls, and also the bone strength is strong so that we are able to prevent fractures. So when we're talking about physical activity, a good physical activity package would take care of the aerobic and the cardiorespiratory endurance parts, will also involve strengthening of the muscles, will ensure that the joints are flexible, and the body is able to maintain an upright position even when subjected to a destabilizing stimuli in the form of balance. So these four components simply together constitute physical activity. So first things first, again, COVID-19 has been extremely stressful on all of us, but COVID-19 is also teaching some important lessons to various stakeholders, including public health professionals and also we as individuals. One landmark study that was recently published in the British Journal of Sports Medicine actually looked at 50,000 people in Southern California and tracked their physical activity levels over the last 2 years, even before the pandemic started, and actually saw out of these people, how many of them landed up developing COVID-19, and among those who had COVID-19, how many of them were hospitalized, were admitted to intensive care units, and or died as a consequence to COVID-19. So the data is so striking that those who were physically inactive, who did not meet the physical activity standards set, were the ones mostly hospitalized. They were the ones mostly who were in the intensive care unit as well. And a significant numbers who died were also found to be physically inactive. So in other words, physical activity seems to have conferred a protective effect in terms of reducing the severity of COVID-19 by itself. A very well controlled trial, excellent data, and published in the British Journal of Sports Medicine. On the other hand, lockdown has also had a big impact on our lifestyles, and one of which has been the impact on physical activity. And what has been demonstrated in this study from Brazil, looking at 5,000 individuals who were who were part of lockdown measures, those who remained physically active were found to have very low levels of anxiety and depression. In contrary, those who were physically inactive seem to have had higher levels of anxiety and depression. I also want to make one additional point in the study that was published in the British Journal of Sports Medicine, the 50,000 individuals from Southern California. Even among patients who developed COVID-19, after developing COVID-19, if they remained physically active, then the chances of them getting admitted to a hospital, or for that matter into ICUs, and the risk of mortality also declined significantly. The big message again, it's never too late to start to be physically active. But this is what COVID-19 is telling us. But we've known this for a long time from other conditions as well, or other situations as well. We've long known that physical inactivity is considered as the fourth major cause of global mortality. The fourth biggest contributor to deaths in the world comes from physical inactivity. In addition, 1 out of 10 premature deaths in the world is attributed to physical inactivity. And looking at the global burden of disease, it has been estimated based on various modeling that 10% of breast and colon cancers can be attributed to physical inactivity. Similarly, 6% of coronary heart disease, and about 7% of diabetes mellitus are also attributed to physical inactivity. So this might look a little complicated, but what is important from this, again, a landmark study published in 2013 in the British Medical Journal by Hussein Nasi and Leonardis. What they actually looked at is they actually pulled in about 305 different randomized controlled trials done in various parts of the world. And the number of participants included in these trials together was close to 350,000 participants. A very solid, strong study looking at a significant number of participants, a many number of studies. And what they did, they looked at a few medical conditions and saw what was the impact of medications on reducing deaths or mortality due to these medical conditions, and compared it with those who practiced a physical activity regimen instead of medications to see what impact it had on reducing mortality. Firstly, in the case of post-stroke, patients who had stroke, it was found that physical activity was even better than medications in reducing mortality. In the case of those with pre-existing heart conditions and pre-diabetes, physical activity was comparable to medications in reducing mortality. Only in the case of congestive cardiac failure, when the heart is not able to pump adequate blood to various parts of the body, medications seem to have a beneficial effect when compared to physical activity. But leaving all the conditions, looking at all-cause mortality in these conditions, the big message that emerged from this study was physical activity is better than medications in reducing all-cause mortality. It is so striking. The evidence is in front of us in terms of the public health benefit of physical activity, not just at the community level, but also at the individual level. So this is just a depiction of the information that is available in terms of the benefits of physical activity. So on the left-hand side, these are more a summary of the various benefits of physical activity. And on the right-hand side, this gives you a quantification of the reduction of the various risks associated with the disease in an individual who meets the physical activity standards. So just for example, the immediate effects of physical activity on improving sleep, lowering anxiety, controlling blood pressure, very strong evidence exists, unchallenged, very clear. And in the longer term, the ability of physical activity to reduce the risk of conditions such as Alzheimer's dementia, the risk of mortality associated with coronary heart disease, the preventive effect it has on 8 different types of cancers, the ability of physical activity to ensure that one maintains an optimum weight, the ability of physical activity to strengthen bones and also improve balance and coordination to ensure that there are no falls, or at least minimize the number of falls as one ages, and reducing the risk of fractures is also quite profound. And just look at some of the numbers that you have on the right-hand side. 30% lower all-cause mortality comparing most active individuals with least. That's the kind of benefit that physical activity can confer on an individual. Even 10 minutes of brisk walking a day is likely to reduce mortality by up to 15%, irrespective of baseline fitness. 30 to 40% lower risk of metabolic syndrome such as diabetes mellitus, 20% lower risk of breast cancer, 20 to 35% lower risk of cardiovascular disease. Evidence is striking. It would really seem like a no-brainer if there is one activity or one intervention that we can bring in our life and make a difference in these plethora of conditions. One would really question, why is not everyone physically active? But saying that one needs to be physically active is only so much, but we need to also be very clear about some standards and guidelines. So this is the World Health Organization's first edition of the physical activity guidelines, which came out in 2020, which clearly pulls in a lot of data to suggest among children and adolescents, the prescribed requirement to be physically active by definition is ensuring 60 minutes a day of moderate to vigorous physical activity, including in about 3 days in a week. Not just moderate physical activity, but you need vigorous physical activity for children and adolescents, including muscle strengthening, is expected to confer a long-term benefit of physical activity on children and adolescents. So 60 minutes of moderate to vigorous physical activity, including 3 days of vigorous physical activity in a week. And of course, it goes without saying, the sedentary behavior should be minimized as much as possible. So in decreasing the screen time and engaging even in light activities is expected to make a big impact on the overall health and well-being. But of course, I'm using the terms moderate and vigorous physical activity here. Let me unpack this and explain this to you in a little moment. But for now, I think it's important to just keep track of the standards that we are being discussed. So secondly, in case of adults, what the standard says is that you will need a minimum of 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity in a week to be able to enjoy the optimum level of health and well-being. And as I said, any amount of physical activity is better than none. So in addition to the minimum minutes required for physical activity in a week, it's also recommended that adults at least twice a week concentrate on doing muscle strengthening exercises, and also making sure that the muscle strengthening activities involve all the major muscle groups of the body, starting from the shoulder to the back to the abdomen to the biceps, the triceps, making sure the gluteals, the hamstrings, the quadriceps, the calf, and all these groups of muscles are strengthened. And the general rule of thumb is that, once you start your muscle strengthening exercises, you don't repeat the same muscle group on 2 consecutive days. You at least give 48 hours for that muscle group to recover. And then you start, working on that muscle group again. So in the case of older adults, it's very similar to what we have in terms of the adults, and do as much and as maximal as possible. In addition to the 75 minutes to 150 minutes of moderate to vigorous physical activity and involving muscle strengthening activities for 2 days a week, older adults above 60 years of age are also recommended to have both flexibility as well as balance and coordination exercises 3 days a week. So children and adolescents, adults and older adults, and the guidelines are strongly evidence-based. And again, to re-emphasize the point, any amount of physical activity helps. So physical activity in special groups, we have pregnant and postpartum women, those with pre-existing non-communicable diseases, and those individuals with disabilities. The key message again is that there are clear standards for each of these groups, but you will see that there is a common pattern of any of the groups or any of the vulnerabilities that one might have. You try to reach the standard that has been set for the different age groups. Whatever is possible, whatever is feasible, you try to get towards that standard and do as much as possible that is physically permissible based on your specific condition. That's the simple rule of thumb and dictum. But we will discuss a bit more on the pre-existing diseases and conditions. So before that, we will have to kind of clarify and define what do we mean by moderate level physical activity and vigorous physical activity, and of course the light physical activity. There are many ways of defining it, but I've just chosen a couple of them. One of the most or the easiest way to define the level of physical activity is using what we call as a talk test. So if you are involving yourself in a form of physical activity where you're able to both talk and sing, then you are doing a light activity. A situation where you are able to talk but not able to sing, then you're doing a moderate level activity. But a situation where you are neither able to talk or sing and you're gasping for breath while doing that activity, then you're doing a vigorous activity. So these are some of the examples that you see here. The slow walking being a form of light form of physical activity, brisk walking being moderate, soccer and jogging and dancing being vigorous activity. But there are good websites which classify and provide you compendiums in terms of what would classify as these. But a talk test is a good way of illustrating what is the level of physical activity. Another slightly sophisticated way of determining the level of activity is using the maximum permissible heart rate for your age group. The simple rule of thumb is that you subtract the age from the number 220, and the number that you get is actually the maximum heart rate for your age. And if you're within the 64 to 76% of this maximum heart rate, then you are doing moderate level physical activity. But when it's between 77 to 93%, then you are doing vigorous physical activity. So this comparison and this definition is important for you to determine the number of minutes you're going to do on the different types of activities, knowing the standards that we just discussed. So I'll just give you a few seconds for you to look at some of the examples of what are some of the moderate and the vigorous intensity aerobic activities. Okay, So moving on, one of the biggest misconceptions and apprehension that happens is that, okay, I hear about some news stories, and I've heard about some incidents where people have died while exercising, or they've had heart attacks and so on. So how do I determine whether I would be able to do physical activity or not? And again, for all those who may have that question, the first important message is that the risks associated with physical inactivity and sedentary behavior far, far, far outweigh the risk of being physically inactive, citing either medical reasons or citing the fear of any untoward event happening during physical activity. Let's be very clear about that. But having said that, there are at least three conditions or three aspects that need to be taken into consideration before determining whether a person can perform physical activities and the level of physical activity that individual can perform. So the three criteria are whether the individual is currently physically active or not. Secondly, do they have a pre-existing non-communicable disease, particularly coronary heart disease, kidney disease, or any form of metabolic disorders like diabetes mellitus. Respiratory diseases are not seen as a contraindication for physical activity. And the third consideration is the level of physical activity one would like to perform. So for example, an individual who is currently physically active, has diabetes, but is asymptomatic, would want to slowly increase their level of physical activity. No medical clearance is required. In contrary, an individual who is currently not physically active, but has a condition like diabetes mellitus, will have to get medical clearance before they are put on a structured physical activity program. I underline the word structured physical activity, which really means moderate or a vigorous level physical activity. It's perfectly fine for them to go ahead and do the light activity. So the general principle is when they say is that when the doctor is able to see a patient walking into their clinic and having a seat in front of the doctor, is not breathless, is not complaining of any obvious symptoms, then clearly that's a message that person can already start doing moderate level physical activity. Having explained this and the fact that I said that data is striking, all possible information is available. And why are people not physically active to the level that we want? And different estimates in different parts of the world suggest not more than 30% of the population meet the physical activity guidelines and standards. So of course, it's important to have goals towards physical activity. One needs to be prepared with having the necessary kind of requirements, including comfortable costumes and shoes and so on, to be prepared to involve in any form of structured physical activity. And there's also a need for commitment. But the thing is, all the three may not be sufficient. The most important or the missing piece in the puzzle is often the need to remain motivated. And motivation by definition is really about pursuing your goal and making sure that there is a goal-oriented behavior. So in order to achieve this goal-oriented behavior, so you will have to have actions to initiate the specific behavior. There should be a set of actions to make sure that you break certain obstacles that might come your way, and also make sure that you have the necessary concentration and focus to be able to reach your goals. But often motivation, happens in a situation where you're calm and things are working fine, your mind is free, and you're envisaging a situation where you're performing certain levels of physical activity, be at home or in a gym or in a park or whatever is your convenience. But this is when your mind is free, and this is your motivation levels are the highest at this moment. But this cannot be taken as the true motivation. The motivation actually comes and questions you at times when your alarm bell rings at 5 a.m. in the morning, when you have to go for your walk or your run, or at the fag end of a day when it's been a long, tough day, when you have the need for doing a physical activity in your schedule. And how do you motivate yourself under these situations and circumstances? That's the key. So this quote actually summarizes what the motivation and a lack of motivation could mean for being physically active or physically inactive. You should be physically active. You need to be physically active. You want to be physically active. It's clear. All of these are clear. But do you have a desire for being physically active? That desirability and the desire is what is going to make a difference in terms of whether you're going to be physically active or not. And what is this desire? How do we explain this? So the answer is indeed lies in your motivation. And as I explained earlier, motivation is not only about activation or initiating an idea. It's also about ensuring that you persist with that idea, breaking those barriers and hindrances, and also making sure that you have the necessary focus and concentration and attention to ensure that the intensity is there for you to be able to reach your end goal of being physically active. So there are various theories which explain motivation. I'm going to play a short 2-minute video to explain the theory of self-determination or of self-determination theory, which underscores 3 components of the importance of autonomy, of competence and connectedness being the critical pieces in driving one's motivation.
Another important part of the coaching process is understanding how to motivate individuals. Self-determination theory provides a framework to developing such motivation. Extrinsic and intrinsic motivation is the start of our understanding. Extrinsic motivation refers to being motivated by external means, whether it be for a reward, such as money or a trophy, or to stay out of trouble with authority, such as police, teachers, and parents. One example could be a child works hard at school not to learn, but to get a grade or to receive a sticker. An example in a football context would be a player is motivated by the status that goes with playing in a certain team. Intrinsic motivation is the voluntary engagement in activities for inherent enjoyment and pleasure. Further, the intrinsically motivated individual is internal in their quest. It becomes a personal quest to bettering themselves at a given activity. In 2000, Deci and Ryan shared self-determination theory with the world. It attempts to develop the intrinsically motivated individual by meeting 3 basic psychological needs. The first need is autonomy. Autonomy refers to the choice of control and freedom over behaviors. For example, in a football session, you might be running a 1v1 activity. So a simple way to allow autonomy is getting players to choose their opponents. A more complex example of autonomy may be setting up a system which allows players to choose the position they play. The second need is competence. This is a feeling of success, or at least the feeling that there is a possibility for success. There's as simple as making sure teams are even during training, or on a deeper level, it could mean that you create different challenges for different individuals within the same context. For example, you could be working on first touch, but the way an individual succeeds is different. One may get a point for scanning, while others may get points for taking their touch the opposite way to the defender. Finally, the third need is relatedness. Relationships are a powerful tool in motivating others, and it shouldn't be underestimated. Relatedness is a sense of belonging or connection with the team and coaches. An example of creating relatedness is as simple as shaking hands with each other at the end of a training session. Ultimately, what self-determination theory provides is a framework to guide the design so that you meet psychological needs to create intrinsically motivated individuals. Thank you so much for watching.
So really, it's about intrinsic motivation, as the self-determination theory says, and that's exactly what we have evidence for as well. So any individual who carries out physical activity for a sense of enjoyment because it is stimulating and it's fun, who are striving to improve their competence, to develop or maintain an existing skills or challenge oneself, or where they see an opportunity to have a social affiliation for being with friends or with family. So doing activities together with friends or families. So the enjoyment, competence, and social affiliation have been proven to be the drivers of sustaining physical activity when compared to health and fitness and appearance. And if these are the only motivators, which are often the extrinsic motivators, the chances of sustainability become low. But having said that, you need to have a mix of both intrinsic and extrinsic motivators. And as we said, so there are times when your motivation levels are high. When your motivation levels are high, then that motivation could be drawn from your external motivation at that point of time. But whereas another time, when you're on the fag end of the day, it's the enjoyment, it's the fact that you're going to be with friends. That motivator could be taking you towards physical activity. There is a need for demonstrating flexibility, rewarding yourself, and making sure that you enjoy and you're doing it for your own good. That sense of motivation is extremely important for you, not just to initiate, but also to persist and also increase the intensity of your physical activity. So the only way to do, to be motivated is you should not wait for it. You have to start today. If there's one better time than yesterday, it is now. So physical activity cannot wait. The data is striking. The information is there. We know what motivates. It's just about getting our act together. And there are several practical ways of making sure that you're physically active. Again, evidence suggests that people who have a clear plan for physical activity and making sure that they have allocated time within their daily calendars are also likely to remain more physically active than others. You've got a variety of fitness apps and trackers. Again, people who use fitness apps and trackers and have reminders are also more likely to adhere to their physical activity regimen. And there are some very practical ways of doing it. I want to credit some of my colleagues here, Raji and Karima, some of whose pictures I've actually taken here to demonstrate at work, practical things like making sure that you park your car far from the exit gives you an opportunity to be physically active. Instead of taking an elevator or a lift, to take the stairs, again, is an opportunity for you. It's these opportunities that are presented, but how motivated are you is the question. And alternate, standing tasks and sitting tasks. Again, in sedentary behavior, the general advice is for every 20 minutes, you are expected to have a 2-minute break and take a short walk around and then come back to your seat if you have to. At home, veiling or increasing the amount of time that you do in your daily chores and reducing your screen time and the time that you sit and lie on the bed can also have a big impact in terms of reducing your sedentary behavior and increasing your physical activity levels. And Qatar is bestowed with wonderful parks around, and enjoy nature when it invites, when the weather is good and when you're able to go and look and do your physical activity outdoors, then so be it. And you kind of get a sense of enjoyment with that. And of course, where you can't, the weather not permitting, you have the alternates of walking in malls, and some of these malls have different routes, and you have the number of steps per route as well. Could also be a kind of an interesting way to remain physically active even when there are weather challenges. So and there are good blogs and there are good kind of tools that are available where you can update yourself with day-to-day tips and also new learning and new evidence about physical activity. Paige Weiner, for example, from Very Well Fit, is my favorite kind of personality, a trainer who gives so much practical information and tips. There are plenty of free YouTube resources which you can tap into, and making sure that you borrow from there, and when the video is playing, you continue to do your physical activity, are all opportunities that technology provides to us. But before I end, I just want to mention that physical activity is one critical piece of our healthy lifestyle. But lifestyle includes 5 other domains as well, and we need to make sure that we follow them astutely. This includes making sure that we have a healthy, nutritious diet in our lifestyle, which is largely plant-based and whole grain-based. We have to make sure that, of course, we are physically active, at least this 150 minutes of moderate level physical activity in a week. We have to make sure that we have a sleep for 7 to 8 hours. Make sure that we don't start having tobacco, or at least quit tobacco if we are practicing them. Making sure that we keep alcohol levels to as minimal as possible, if possible, not go into alcohol at all. And also making sure that you have good coping mechanisms for stress, making sure that the emotional well-being is well maintained, and also a good social connectedness through your friends and family is quite important for your healthy lifestyle. And these pillars of lifestyle medicine will help to decrease your risk of non-communicable diseases and increase your health and well-being overall. And at the Institute for Population Health, we run various short courses, symposia, and a flagship lifestyle medicine course where you can actually understand all the components of lifestyle. So the Qatar guidelines on physical activity is a massive commitment from Qatar, and it's a model for the world in which clearly a country is showing what are the standards for its citizens and residents, and gives you practical tips in terms of taking them forward. I'd highly encourage you to look at that very simple language, very easily written, for you to look at some of the national guidelines, which are exactly in line with the global guidelines I discussed earlier. So in summary, be aware, and as I said, it's a no-brainer that physical activity makes a big difference in our lives in terms of improving our overall quality of life and reducing morbidity and mortality. Make sure that you have a plan and be committed, and most importantly, stay motivated to ensure that you meet your goals of physical activity. So be physically active, stay healthy. And I once again thank you all for your patient listening. And
wonderful to have you all here with us. Thank you, Dr. Doraiswamy, for that wonderful session and for those key messages. I think these are very important reminders for all of us. And remember, the bottom line is your health. So that's it. We do everything for our health, for you.